Assalamu alaikum, the communication day. Mr. Sami on trial research of new treatment piclizumab for rheumatoid arthritis. Was on piclizumab, patient symptoms were improving in the form of joint pain, but now the improvement is not anymore. So the consultant recommended to stop piclizumab and to start him on adalimumab. Please discuss this issue with the patient and address any concern. We will start in seconds. Did you prepare your points, Dr. Sarah?
Okay,
Okay.
start.
Yeah, do your best. Now the
Okay.
timer there. I will remind you when 2 minutes left. Good luck. Here you go.
Okay, hello, I'm Dr. Ghani, Dr. Iqlik. Today, may I confirm you are Mr. Sami? You are Mr. Sami?
Yes, doctor. Yes, 40 years old.
Okay, you are 40 years old. Okay. Hello, Mr. Sami. We are here to discuss issues related to your health condition. Is it okay with you?
Sure, doctor. Sure.
Okay. Can you please tell me how do you know what your health condition?
Yes, doctor. I have diagnosed as rheumatoid arthritis. I was on treatment. First, it was my joint pain was improving, but now since 1 month, it is severe joint pain. Can't work. Please, doctor, can you increase the dose of this treatment?
Okay. So, Mr. Sami, you know that that you were in research trial.
Yes, doctor. I know. Yes, I am a trial. Yes.
Okay, let me appraise you for this. Thank you very much. And how are you doing now?
No, 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 not good, doctor. I have severe joint pain.
Okay. Okay. I need to tell you that this about this medication that used in this research trial. You know about it. The doctor told you about it.
Yes, doctor. I know. I know everything
You
about the
know
trial.
everything about this trial.
Yes,
Okay.
doctor.
Okay. This medication now causing you no improvement in your symptoms and causing you have now more pain, and so our consultant decided for the best interest of your condition is to stop this medication and to start another medication for you to trying to control your symptoms. Are you with me?
Yes, doctor, but why? He was working good, doctor.
Yes, it was working good first, but now you are not improving on this, and this is for sake of your health, and because you are very precious for us, so we don't want you to suffer more.
Okay,
Are you
doctor.
with me?
Okay, but doctor,
Okay.
they pay me. They give me money for this for try this treatment. So they will stop sponsored me. Sponsor will stop.
Okay. For now, we need to stop this because your symptoms are not improving, and we need you not suffer more. And I think yes, they will stop sponsoring because this medication is not helping you anymore.
Okay, doctor, it is difficult, doctor. I am retired. I dependent on this money, so I can't stop this treatment. Sorry, doctor.
Okay, okay. This issue we can try to solve it by calling the social services. They can interfere with this and they can help you in this regard. But about this medication, it is for the best interest of you to stop it and to start another medication. It is called adalimumab. Do you know about it?
No, doctor. No,
You have ever take it before?
no.
No. Okay. This medication is will act on your defense system, trying to help you to stop these symptoms that you have and to stop this joint pain and try to improve your symptoms. Okay.
Yes, yes, doctor. But the doctor tell me that the previous drug was the same. It will decrease also control my defense system. So it is the same drug.
Yes.
Okay, but
Yes.
why you stop my first drug? He was
Okay.
working good
Okay.
with me in the past. Yes, doctor.
Okay. I understand this. Okay, and I appreciate your concern, but I need to tell you that affecting the defense system differ from drug to other. There are many ways to affect the defense system. The former one was affecting in by affecting something called the complement system. It is like system affecting the uh, the inflammation in your body, and the second one will affect another type of system and control uh, another agent that can cause you this pain and this soreness.
Okay, doctor.
So this medication, which is adalimumab, will act on such a substance. It is a protein. It is called tumor necrosis factor. This protein is released from the inflamed joint, and this
I
protein can, you
Yeah,
know.
doctor, I didn't know. I didn't know, but I signed for this treatment. Who will tell the company that I will stop the treatment?
Okay, we will tell them, your treating team and the consultant will tell them about this, and that is causing you harm, and we need to stop it because of your health, of your health issues.
Okay, doctor. Okay, but
Okay,
they
so
haven't any contact with your consultant.
how is that?
Yes, they contact me always every week. What I will tell them about stopping this treatment?
So you take this medication without the knowledge of the consultant?
No, doctor, consultant, no, but the company contact with me and they give me money for taking this medication.
Okay, but for now, if we weigh the risk for the benefit, the risk from taking this medication will be more than the benefit, and so this can affect your health. I
Okay,
think if we think like this, we will decide to stop this medication, even whatever the money or the deal you made with them. Your health is above this, right?
yes, doctor.
So what do you think?
Sorry, doctor, I can't. I signed for the company. I will take this medication. I can't stop this medication
And why is that?
because I signed in a consent not to stop the medication.
Um, Okay, I don't know about the deal, but
Okay.
I think you have to reconsider it again, because this medication can affect your health more.
Okay, doctor. Okay.
Can you
Okay.
of this again?
Yes, doctor. I will think. Yes.
And about taking the new medication,
Okay.
you will give it a try.
Try what, doctor? Sorry.
The new medication, the adalimumab.
Okay, doctor. I will think. I will contact
Okay,
the company because I they give me money. Who will give me money for? I am retired.
Okay, 2 minutes left.
okay, okay. Again, okay. About this concern of money, we can talk to the social services. They can help you in this issue. We can talk to them and see what they can do for you. And about your health, it is the the most important topic now, and you should, I think you should make it the superior for anything else.
Okay, doctor.
Okay,
Thank you. Okay. Okay, doctor.
so do you have any other concern?
No, doctor. Thank you very much. Thank you.
Okay, so as I understand, you are retired now.
Yes,
right?
doctor. Yes.
Okay, and we can talk to the social services. They can help you if you need any support. Okay.
Yes. Okay, doctor. Thank you very much.
Okay. And about your with whom do you live?
With my wife.
Okay, and she is dependent on you, right?
Yes, doctor. Sure.
Okay, we'll take this in consideration. Okay. And about smoking, do you smoke?
No, doctor. Never.
Okay, and do you drink alcohol?
No, doctor. Never. So, doctor,
Okay.
when I will start the new treatment?
Okay. According to the protocol, after we stop the treatment you are on now, after that, may do some test for you, some blood test for you, and after that we can start the medication. Okay.
Okay, doctor. Thank you very much.
So you have any other concern?
No, doctor. Thank you.
Okay.
I will think about the new treatment.
Okay, appreciated. And I will give you some leaflet brochures about the medication, the new medication, to know about it more. Okay, and so you can decide what is best for you. It's okay.
Okay, doctor. Thank you very much.
Thank you.
Okay, well
Thank
done.
you. Well
Well
done,
done,
Dr.
Dr.
Sarah.
Sarah.
Yes,
Yes.
really. But the only comment is there is a lot of trials. This kind of trial is sponsored. It is money. Patient take money for try a new treatment. So first, the patient tell you, Dr. Sarah, that yes, I take medication for rheumatoid, and you will say to him, yes, I see from your notes you have in a trial. They will said, yes, doctor, I am on the research trial. So the next, what kind of research you are in? They will tell you, that I am in a trial of a new medication called Biclozumab, and the company give me money for take this treatment. Okay, then you will tell him that some people this drug some people give him some improvement in the first, then will be no improvement, maybe not improved. So my consultant, you are not you have now a severe joint pain, so my consultant recommended to stop the trial and give you a treatment called adalimumab. He will tell you that is the same drug. Why you stop the last drug and give me a new drug? They will tell him. You will tell him that this new drug is approved. We know this drug will have benefit for you. We tried this drug much more, and we know this drug very well. So we will start the new drug. Then the patient tell you that okay, who will tell the company? You will told him that how they contact you. The patient will tell you they contact me every week and told me is there is any side effect of the drug, any improvement, any not improvement. So you can tell him, okay, you can tell the company, the patient can tell the company, I want to stop the drug. So the patient next will tell you that you give me money and I can't stop this drug. You can tell him that I know there is a consent, but in the consent they write if you want to stop this trial, you can stop this trial. No one can force you to take any type of medication, and the new medication is the best interest of your condition. And the trial treatment, there is no improvement, so you should stop this drug. And I will tell my consultant also to contact the company and tell them that there is no improvement of the trial drug. And then some social support like that. That is the case.
Thank
Okay.
you. Thank you, Dr. Mahmoud.
It is a new case. It is from UK, Dr. Bess. Tom, in
Yes,
your
yes.
هو ايه
opinion.
الميكانيزم اوف اكشن بقى؟ ايه الميكانيزم اوف اكشن؟ لانه بيجيب لي
Yeah,
حاجه تانية خالص.
interleukin 1 I guess adalimumab interleukin 1 not tumor necrosis
No,
factor.
but it is
adalimumab.
يعني who I tell Dr. Sarah the patient is working in
Yeah, no
tumor
need to
necrosis factor.
explain.
No need. I didn't know what is tumor necrosis factor. I
other
am
mechanism, it is act by other mechanism.
Just
I meant
yes,
to
yes
say this.
that's enough.
بس
More
this is
than
another
enough. Yes.
mechanism, and we tried this medication in more patient and show improvement, and we know very well about this medication. Just that, but I am a patient. I don't know tumor
Yes,
necrosis
exactly.
factor. I am a doctor. I didn't know tumor necrosis factor.
Anyway, yes. In
Okay.
general, she did well. Yes.
Yes, doctor. As far as I did it well, really.
Yeah. And always, Dr. Sarah, try to put the best interest as the goal of our management. Always put it in the top of priority. The medication in the best interest for your condition right now. The previous medication, yes, it started as the best interest, but we discovered that or we noticed that no improvement or there is worsening. That's why, in the best interest for your condition, the consultant advised and decided to switch to another medication. It's different in the mechanism of action, but it has more benefit than the previous medication. Okay,
Okay.
there is always you have to mention the side effects, but always the benefit outweigh the risks. That's why he put it or he decided to start it for you in the best interest for your condition. I need money, it's our priority. Okay, we appreciate that, but be sure that your health in the top priority for us. For that, we will refer you to the social worker, occupational worker. They can help you in this regards. However, the top priority for us now is your health, for which we will start this medication after your permission or after your acceptance. If you agree, please sign this form for me, or I can document that you are agree to start. Because monoclonal or this medication, chemotherapy, and some of this medication which has side effect or which is considered as unique medication, you have to get consent, right? Like chemotherapy, like monoclonal or biological. So you can't give him a consent and you can tell him, please read carefully this consent. If you agree for that, you can sign it and be sure anytime you can withdraw. And I will give you some leaflet brochure about the medication, the dosage, the frequency, the route, how you can take it. Even you don't know, no need to mention how he can take. Just give him leaflet brochure as you did at the end, but try to make it earlier because he doesn't know anything about the medication.
But
I will give you.
I think Dr. Bassem, the Biclozumab is a biological treatment. So the patient made all investigation of biological. So يعني the doctor told me that no problem about tell the patient that we have to do like TB or HIV or HCV
Okay,
because it
but
is the same pain.
suppose did it before, right?
Yes, yes, this is a
So why
biological
you?
also.
So
Yeah,
why I should repeat it?
yes, yes. I tell no problem about يعني about not tell the patient يعني not tell the patient we have to do investigation like
No,
TB or
no,
like
yeah, no need, no need.
no
It's
need.
already,
Yes,
yeah, has been done before.
yes, doctor.
Yeah. But also again, repeat the side effect. You have to repeat. As any patient, as any medication playing or affecting your defense system might be weaker than before. You have to be away from sick patient, from the crowded areas, and from the hospital to be cautious, using some precaution while visiting the hospitals, or anyone sick at your home. You should stay away from him. Such kind of red flags and instructions, it will give you a good mark for the welfare. As I said, always write red flags in your paper, even without mention what the red flag is. But at the end of the session, at the end of the station, you can tell him, the patient, please, we are taking care of you, and take care of yourself. Anything you can come to us, you can call us. This is one of the red flag. or safety netting. And you can add specifically in this scenario, if you feel fever, if you feel something unwell, if you feel you are feeling not well, please visit us. We call this medication hurts the defense system. But explaining how the medication do or how the medication does between both medication, it's not necessary. You can just say it's playing or it's suppressing or it decrease the defense system by another way, which is approved by the guidelines, and that's it. Okay, Dr. Sarah, but in general you did it great. You try to convince, and I think he was convinced, and you will get the mark. The
Yes.
leaflet as at the end as you did, and the social support very important. This is his main concern: how I can get money. This is not the matter. The money will be provided by any support by our social worker or whatever. Okay.
Okay.
Any question, Dr. Sarah, Dr. Mahmoud?
No revenge, Dr. Sarah. Okay.
Okay, write for him difficult scenario, Dr. Sarah, please.
Yes. No revenge.
And
Yes.
in the group.
You sent already. Any comment
Yeah.
from others, please? Dr. Ryan, Dr. Mahanna, anyone want to add comment, please feel free to comment.
Yes.
Yes, sure, go ahead.
So there's nothing Beclizumab. This is
Excellent.
Eclizumab. There's nothing named Beclizumab.
Yes, Dr.
Yes.
Once I
Ahmed, it
searched
is.
for it and
Yes,
I didn't
it is a
found it.
trial.
Okay.
Is that in
No, no, no.
exam?
It's even not a trial. It's not. It's not a drug.
I am sure it is Beclizumab, Dr. Ahmed. I am sure.
No
Okay.
problem, no problem.
Yeah. Sure.
We'll not
Second
argue
thing,
about the name.
if the patient awake and I'm speaking to the patient,
Uh-huh.
what's the point to say best interest? So usually best interest will not say it unless the patient lose his mental capacity. So, but not, I mean the phrase in the best interest will be never mentioned unless the patient is comatose or patient.
Why?
Sorry.
Why?
So we can say this is the best option for you, but not best interest, because best interest coming after if I'm awake and I should be consented. So I have a right to take a medicine or not. You are not assigned to give me the best option for me to do this, but it's not best interest. So
Yeah,
best interest is only
doctor,
one. The only
doc,
one who knows the best interest is the patient.
Dr. Ahmed, this expression is being used by the most professional tutors in communication. It means that you are the one who is expert in taking medical decisions. He is not
So what is the best?
has the
But what is the
knowledge
best
like you.
interest? No,
No,
me.
Yeah,
Doctor.
from the opinion of the medical team, this decision was taken in your best interest في صالحك. احنا عارفين طب اكتر منك طبيعي. لا
بس
البيشنت
بس انت
بتاخد.
ما تقدرش تفرض على العيان وجهة نظرك حتى لو
No,
دكتور.
لا
no.
هي
This is
بتتقال
the
كده عادي،
task, Dr.
مفيهاش
Ahmed.
مشكلة يعني.
This is the task. Best interest to
اه
convince a patient. This is the way how to convince in paces. We know there is another medication, maybe the best interest, but in this station, particularly in this scenario, particularly, this is the best interest for you. He told you that I get the other medication, yes, but
No, the
he
best
got
option.
okay. He got the first medication for purpose of money. He took it for research and
Yeah. We
sponsor.
will stay, yeah, this drugs is no more effective for you.
Yeah,
We'll
so it
switch you to
was
another kind of drug which may work better. But I mean best interest, this phrase, I believe it's not correct.
any book in the paces how they are convincing they are mentioning this word best interest. Why? Because it means that you are convincing the patient by
Yes.
consultant
If
decision.
if you are discussing with someone else, not the patient. I mean
Why?
if the
Is it
patient is not
jargon?
here and
Is
the
it
patient.
jargon?
No, not jargon. It's not a
Okay,
jargon.
so what is
So
the
no one understood me now. So 1 second. So if the patient in ICU like BCI and
okay?
he died, he will tell, yeah, we done the BCI on his best interest. Patient
Yes.
came comatose, yeah, we done it on best interest. But if you are speaking to the patient face to face,
No. Even the
it's not a
patient
best
came face
interest.
to face.
You may use another. Okay.
what is the best word alternative to this, or what you can say?
No, best interest means
Okay.
you are acting on what the patient, if he's awake, he will decide the same. This is the best interest means.
It's not only the patient decision, it's the consultant decision. Why the consultant and why
Consultant
this scenario
decision
is here?
again. So patient now is awake. He can decide for his future. If I got cancer, I will not receive chemotherapy. He's right. He's right to
Okay.
refuse treatment. Fine.
Okay.
At this point, we agree on. So I am when I got cancer, I will not need chemotherapy. If I got comatose, please don't admit me to ICU. This is my wishes. Okay.
Okay.
Okay. If I have no wishes and I got sudden collapse in the street,
Okay.
so what is the best interest to admit me to the hospital and do CPR and give me mechanical ventilation? This is the best interest of me.
And who give this decision of best interest? The consultant, right? Or the
Yes,
medical
yes,
team.
but you cannot while speaking to the patient himself to say I am acting in your best interest because his best interest is not your best interest. No, so
I got your point.
no, no.
Suppose the
So
patient will
so
share it with
patient
me. You
number
mean?
one, if the
Yeah.
patient awake,
Okay.
consent.
Okay. We
If
are
not awake, best interest.
okay.
So
We are
always
saying this is the best interest from the consultant opinion. If he
so
has he if he's agree,
it's
he
not
can
the interest means the patient wishes, or if he has no wish, we are expecting as a family. So my dad has no living wish, no advanced directive. So when he got sick, I know him well because he's my dad. So I will let the consultant know. Yeah, if he's awake, he may choose this. This is the best interest.
anyway. I want to tell you also this is the way how to convince in basis wise. If it's different in the real life,
I
but in
mean, no,
basis
Dr.
life,
Bassem, I'm not against, but I just say switch it from interest because the interest means the patient interest.
okay, this is basis word. It's not something you are using in the practice. So just do it in its purpose and leave
دكتور
it after you finish exam.
يس هي دكتور احمد بيست انترست يعني من ما هو اكثر مصلحه ليك، اللي هو ما هو في صالحك من الناحيه الطبيه، من وجهه نظر الاكسبرتس الخبراء،
ايوه،
ملوش
هتتقال ايه
علاقه.
بقى؟ هتتقال ايه؟
هي بتتقال
This
كده عادي،
this
والله
drug
بتتقال كده.
could work better for you, not in your best interest. They are
طب
overriding the patient. Okay.
احنا سمعناها عادي من ناس والله بروفيشنالز جدا، وقالوا بتتقال كده لسبب ان انا علميا او طبيا عارفه اكتر منك. ده قرار الميديكال تيم،
ايوه،
من
انت
الميديكال
كدكتور
بوينت اوف
عارف
فيو.
اكتر منه
It's not your
بياما.
decision, Dr. Ahmed. It's
ايوه معاك.
consultant.
الديسيجن بتاعك ما اسمهاش بيست انترست.
Okay, again, it's
Okay.
purpose or exam purpose. Leave it
Yeah,
after the
Doctor,
exam.
Yes.
Dr. Basim. I'm
Dr.
not.
Ahmed, I'm always saying this is my opinion and it's humble opinion. Anyone can follow or you can ignore it totally.
I'm
If
not
you are not
ignorant.
if you are not convinced with, don't say it. But I am saying it. Dr. Ahmed want to say he's okay. Dr. Sarah want to say it. It's her wish.
Yeah. So just okay.
And the
It-
examiner will give you as he wish also, Dr.
I
Ahmed.
didn't hear or I
Honestly,
didn't.
most of the doctors they like this,
Yes,
like this
Yes.
sentence, best interest of you and your health condition.
any book, not
Yes,
only examiner. Every book writing like this. And by
I
the
don't
way,
think it's a wrong. يعني, yeah.
yeah, thank you, Dr. Ryan, for
So only me thinking. Thank you.
because also in real exam wise, no comment or no feedback written. He mentioned best interest. It's not
Exactly.
something
Yes.
bad to mention it. Especially why you are in this task, why you are doing this task with the patient to convince him. So why they wrote it for you? Either do it or ignore it. You got it. So why you are sitting with the patient now? If something not in his best interest, why they wrote it for you?
I
They
mean,
are not giving.
Actually, I think
you may say another words. You may say, I believe this drug will may work for you, and just ask, would you like to try it? I mean, I am not against the doctor is knowing more than the
Okay,
Definitely.
let's assume this word meanwhile is the best interest. After 1 month, it's not the best interest because some side effect happen. Now there is another best interest, so it means occasionally and right now it's the best interest. What the problem if we mention it? Dr. Ryan, what you want to say? Let's hear also Dr. Ryan. Maybe she has some different opinion. Dr. Ryan, please.
No, you are right, Dr. Bassem. Yeah, I just wanted to say that this actually sentence might save you in the exam, because they like this sentence a lot. يعني, from the tutors I heard from a lot and the courses I attended, they actually like this word.
They
Sometimes you might
like
not
it
find an
in good
answer.
place. In,
There is no such a place, I think,
I
in my
think
opinion. يعني,
I think
in
if
my
we have
opinion.
another scenario, like Mrs. John came on behalf of her husband, and her husband is hospitalized, cannot attend. Yeah, this is a perfect word to mention. I mean the situation. I didn't mean they like this term or don't like this term. No,
I
I mean
I
in
got
this situation, if you're speaking to the patient, there's no point to mention your best interest because he knows his best interest. I want to die.
That's why you are
I
giving
got
him the option to agree or
Yeah.
disagree.
So I'm not
yes.
saying best interest is bad. It's not to be uh, said in front of patient. When you talk to the patient himself, no, use it if someone else with you in the meeting, not the patient. This is my point, which I try to explain it.
Okay,
The box mentioned in best interest. In best interest, yes. If you are speaking to the wife, to the son, to the daughter, to the brother, to the sister, yeah, mention best interest. But if the
okay,
patient himself with you in the room, I will decline any drug. I have the right.
okay, Dr. Ahmed.
You got
I
my
got
point.
it. I got it. Yes. So
Thank you.
again, it's optional. Any doctor want to do it, do it. Anyone disagree, follow whatever you feel you are satisfied with. Okay. Just to move on in this session, please. Thank you, Dr. Ahmed and Dr. Ryan and Dr. Dina. Yeah, it's hot discussion, but we have to do the second scenario. Dr. Sarah, I will read the scenario, then you can start right away. Mr.
Okay.
John, 18 years old, who was previously healthy, was admitted as an emergency, having had three grand mal seizure in the space of about half an hour. While in the nightclub, he was paralyzed, intubated, and ventilated. CT scan of the head was normal. The day after admission, sedation was withdrawn in the intensive care unit, and he woke up. There were no neurological sequelae of his fits, and on taking the history, it emerged that the patient had taken two ecstasy tablets during the evening. There was no past history of epilepsy, and it seems likely that his fits were caused by taking ecstasy. He has been transferred from the intensive care unit to the medical ward. The patient mother, Mrs. Sophie, has asked to see you, and nurses have told you that she is keen to find out the cause of his condition, why he had the seizure, and what further investigation will be necessary. Please sit with his mother, address her concern. The patient name, Mr. John, his age is 18 years. If we are ready, Dr. Mahmoud, we can start.
Yes, Dr. Bassem.
Yes, take care
Yes,
of
okay.
this scenario, okay? Go.
Okay. Hello, good morning. I'm Dr. Musa, doctor in the medical ward today. Let me could you tell me what's your name?
I am Miss
Can
Sophie.
I, Miss Sophie? Nice to meet you, Miss Sophie. Miss Sophie, how can I help you?
Okay. I'm here because my son here in this hospital, he has been here since last night, and they told me that he has fits, and after that he came to the hospital with his colleagues, and they put him in the ICU. Now I want to know what is going on.
Okay, did you see your son today?
Okay, I see him. Yes, they transfer him to the ward.
Okay, it is good news. How is doing in the world?
He is
You
okay,
is okay.
I
It's
think.
good. It is good. Very good to know about the improvement of your son. As you mentioned, yes, your husband has your son has been admitted due to fits, which is excessive discharge of order from the brain to the muscles. But yes, this condition has many causes, and we do a lot of scans and investigation to find the cause. Yesterday, he was admitted in intensive care unit, as you mentioned, and he transferred today to the ward, and he's doing well at the ward, and he will be seen by the consultant, and will tell him when he will be discharged.
Okay,
Okay. Do you have
he
any
was in
concern?
the he was in the ICU. That mean his condition was severe?
Yes, sure. Yes, I appreciate your concern. Your son has been presented to us due to fits, and his his conscious level was not good. So we have to do something called put a tube in his throat to protect his airway. You know, during if he lost his conscious level, maybe aspirate, which means that regurgitation of food or fluid from the food pipe to the air pipe. So it is the most important thing to protect his airway.
Why? What was the cause, yeah, doctor?
I totally appreciate your concern, but you know, FEETS has a lot of causes. We investigated, but we investigate and do scans and investigation to find the cause. But I'm sorry to tell you that we have to keep the confidentiality of the patient. So now your son has woken in the ward. You can talk with him.
What do you mean by confidentiality? I need to know what is going on with him.
Yes, what we have at the current situation, your son is doing well. We did to him all investigation, all scans to find the cause of these fits. There are a lot of causes, but I am sorry, I can't talk more about his condition without his permission.
Could this
I am
because
sorry.
he
I am
drink
sorry.
alcohol a lot? Could this be because he drink alcohol a lot?
As I totally appreciate your concern, taking alcohol alone is one of the causes. There is a lot of causes of fits. But as I told you,
Does he have
legally,
any dangerous disease?
um, mm, I appreciate your concern, but in the usual practice, we exclude any causes like malignancy or any dangerous disease.
Is it epilepsy? Because I read
Um,
about it.
yes, can I ask you why you think about it is epilepsy?
I read about it, and he has a brother that he died from epilepsy complication.
Sorry, my condolence for you. Can I know how old his brother when he diagnosed with
He was
epilepsy?
young. He was a child. He was young.
I'm very sorry for your loss. But let me explain you two more. We did to your son a lot of investigation and tracing of the brain. Till now, he is followed by a nerve doctor, and he saw your son yesterday and today, and he not suggest that he has epilepsy.
So are you sure?
Yes, I totally appreciate your concern, but as I told you, there is a lot of causes of epilepsy. You know, there is like a precipitating factor like coffee, like any stress. It is a lot of causes. So till now, I think it is not epilepsy as recommendation of nerve doctor. Um,
Okay,
okay,
so what changes we can do in his life after this
okay.
attack?
That is a good question. I totally appreciate your. That is a good question. But we have. If you don't mind, we can sit with your son and talk with him about what he have and what will we do. You know, your son is the most important one. Is the most important one in this situation. He must to know everything about his condition and share with us the management plan and treatment like that. So if you
But he is my child. I need to know.
yes, I totally appreciate your concern. He's your child, I know, but he is also my patient. So I have to keep my patient confidentiality. I am sorry to tell you, I am not allowed to speak about your son condition without his permission. I am sorry for that.
Okay, okay. He started a new job now as a car driver.
Yes.
Is he going to continue in his job?
Okay, I appreciate your concern, but it is legally. We should sit with your son, and according to he has fits, he should stop driving till he will be assessed by DVLA. DVLA. So we have to sit with your son. Okay.
Okay, doctor. Thank you.
Okay.
2 minutes
Do you,
left.
do you have any concern?
No, doctor.
Other
Thank you.
concern? Are your son, did anyone dependent on your son?
No.
Okay. Do you need any help?
Uh,
Any financial, any support?
no, no, thank you.
Okay. Okay. Let me summarize what we have today. Your son have been admitted in the hospital due to a fits, as you mentioned. And we have to sit with your son because it is the most important person in this situation. He should share with us the management plan. And if you need anything about his condition, we can sit with him to know everything. Okay. Do you have any other
Okay.
concern?
No, doctor. Thank you.
Okay. Can I know if your son has has any child? Is he married?
No, no, no.
Okay, very
Does he
good.
need any further assessment?
I totally appreciate that, but we have here a good doctor, and he also followed by my best, one of the best teams in the hospital, and we will sit with him. If you need any other assessment, we will have discussed with him that issue.
Okay.
Okay, thank you very much. Do you want anyone to drive you to home?
No, thank you.
Okay, thank you very much, Miss Sophie.
Okay.
Perfect,
Okay.
Dr. Mahmoud. MashaAllah, perfect.
Thanks.
Okay, Dr. Sarah, please, can you come?
Okay. Okay. Good, Dr. Mahmoud. Okay.
Thank you, Dr. Sar.
معلش أنا ضحكت.
It is.
Okay. First, you need to confirm that she is the next of kin. Okay. And after that, you need to confirm that you took the permission. You just assume that you took the permission from the son to talk with the mother about his condition. You can, if okay, you can assume that you can talk in everything except talking about these drugs. Okay, so you can talk about everything, about all the whole situation that he was in a party celebrating and have alcohol a lot and have these fits and then came to the hospital and put in ICU. Okay, all this okay. تمام. Okay, but you need to tell her that there are a lot of causes can cause him epilepsy, maybe excessive alcohol, maybe also it is a new onset epilepsy. Okay, and maybe also maybe a tumor or something dangerous. We need to check about this. Okay, after that when she said that he is a driver, he need to stop driving. He need to stop driving after fits for the first time, and this was recurrent 3 times. He need to stop driving, and he need to inform DVLA. Don't need to say a specific timing, but tell further assessment. Okay. Okay. When she asked, is his condition is dangerous? Is it genetic? You can tell her, no, most probably, no. But we need to do further assessment if it recur again. If it happen again, then we can think of something dangerous. But for now, we need to monitor him only. Okay, but you talk about confidentiality very much. You can talk about this in a hidden way, not this with obvious way, right? This. So you can have a chat with your son. You can know the exact cause. Okay, okay, and you can explain the epilepsy appropriately and the seizures, and that we have done this EEG, the brain scanning, the brain tracing, and it was normal and nothing on it. But we need also to monitor him again, because if it happen again, this will be a dangerous sign. Okay, you can talk about everything except talking about extent. Okay.
Okay.
Hmm.
Thank you, Dr. Sarah, for this scenario. Yeah, I agree with Dr. Sarah regarding the point of confidentiality. You need to be gentle with her. Okay, she's a mother at the end. Yeah, it's okay also not to breach the confidentiality, but you can tell it by another way. I'm so sorry, I cannot tell you something related to him. It's something private to him. But you shocked her. No, I will not tell you because this is his confidentiality, and I'll not tell you about his condition. No, you can play with the word. I'm so sorry about your son, and be sure that he's under good care. We are trying our best to recover as soon as possible. If she insists about what happened, why he has again asking, so you can say as simply, it's a matter of some privacy, and I cannot tell you what happened exactly unless he could give us permission, or at least you sit with him and you can had chat with him to know exactly what happened. So far, good news that nothing in the brain. So far, I mean, it might need another assessment. And again, as I said, the previous scenario, red flag. She asked you what instruction. What the problem if you told her about red flags of seizures? Please, in the coming weeks or days, stay close to Mr. X. In case of he has any abnormal movement, any loss of awareness, don't hesitate to call us to bring him to us. Don't leave him alone swimming, and give some instruction to Mr. X not to close his bathroom door. It's risky to have such kind of seizure or this abnormal movement or loss of awareness while he's locked at a locked door. You got it? This is very important, and also again, it's for the welfare. This patient will go home, and his mother will be together with him, and she should know what might happen in the future, and she should know what she should do if anything happened like this. This is the contact number of our emergency department, or call ambulance immediately if you feel any abnormal movement, if he feel his behavior change. Still, you might, or the patient might have another attack of seizure, because we don't know he will stop this medication, or sorry, this drug, or no, or he has another overlap condition which is not diagnosed now. She told you his brother has having epilepsy, so all possibility is there, right? Regarding the driving, yes, you can tell her. Meanwhile, he should stop driving, and we will reassess him again, and we will update him about the timing for resuming his driving. This is regarding the driving, the job. You missed the question for alcohol, smoking. Does he smoke? Does he drink alcohol? These things you should give here some instruction about. Instead of giving some you summarizing. I didn't prefer to summarize in this condition, because whenever you summarize, she might ask you again, okay, doctor, so what happened, doctor? Why he got this? Why he got this seizure? Please, doctor, to help me. So you want to overcome this point. Don't repeat it again. Okay?
Yes.
Yeah, better.
Good
Yeah,
guess.
you can, or you can ask her. Can you summarize what happened between in the discussion between us today? What you got from this meeting? But if you summarize, she might stop you, doctor. So, doctor, what happened? Why he feel like this? Why he got got seizure or abnormal movement? I'm worried. Please, doctor. So, stay away from this point and try it not to repeat it. Okay, this is my opinion. At the end, closure, as I said, but red flag very important. Believe me, if you say red flag in your station, you will get full mark. Any instruction regarding seizure for the patient or to the mother, it will make you safe. Why? Because this patient might go home and he might get the seizure again after exposure to ecstasy, or maybe even without ecstasy, maybe because of alcohol or whatsoever. So the best thing is to give some instruction. Okay?
Okay, Dr. Bassem.
Yeah.
Okay.
Any question or any comment? Any question from Dr. Mahmoud or Dr. Sarah?
No, good case, Dr. Sarah. Good case. It's
Yeah.
very
Okay,
straightforward.
this case discussed well in post test
Yes.
about the confidentiality. You can see it and see how the candidate did it well, really. يعني. He said all things and keeping confidentiality without confrontation with the mother, because he
Yes,
said, I
exactly.
am the doctor and I am the mother. What is
Oh, my patient. Yes, he's my patient.
Yeah, always try to be as much as you can gentle while discussing or saying even real things. Yeah, we know this is the truth, but to deliver the message by gentle way is much better than shocking the patient or delivering by such news like this. No, this is his confidentiality. I cannot tell you anything. Try to be more gentle than this, okay?
Yes, okay, Dr. Bassem. I have a case, Dr. Bassem, to you. Consultation.
Hmm.
What?
Okay.
What's your opinion?
We can do it tomorrow, okay?
Today?
But not like autoimmune
No, no, no,
pregranulosa.
no, 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 no. It is a
Okay.
good. It is a good case from
Okay,
any.
okay. We'll do it tomorrow. Okay.
Okay, Dr. Bassem.
Thank you, Dr. Mahmoud. Any
Okay,
comment?
thanks.
Thank you. Any comment from
Thank
others,
you.
please? Thank you, Dr. Sarah, as well. Any comment from others? Dr. Ahmed, Dr. Rayan?
انا قاعد ساكت خلاص.
No, no. Dr. Ahmed.
انا بهزر معاك
Thank you
Yeah,
all.
it's
انا بس
okay.
محدش وصل له البوينت اللي انا بتكلم فيها.
No, no.
انا مش زعلان من
We
بيست انترست، انا
Dr.
زعلان.
Ahmed.
لا
Always.
احنا فهمناك يا
Yeah.
دكتور أحمد.
انا قصدي يعني لما بتتكلم والعيان مش موجود وهو مش حاضر، احنا هنقرر بناء على رأيك، لكن مش هقرر لك انت لو انت مش عايز تتعالج. دي وجهة نظري انا، او ده اللي
Okay,
بشوفه.
we got it, and I told you many times. It's a sake of exam. We want to pass this exam, whatever the weapon we are using. And
Yeah.
this is one of the weapons. Best interest. Okay, I will say it in any situation. Need to say it.
Yeah.
Okay.
Okay.
But if you don't, you are not convinced with.
No,
You don't.
if the patient is not here, I will say best interest. We are using best interest many times, but in other situation is
Okay.
we
I
are.
got it.
Oh yeah, yeah.
Okay, but not in the paces way. Maybe in the real way. Yes, in the
Maybe.
real life, we are saying when the patient with sitting with me or the mother or whatsoever the situation. But in paces in front of examiner, you are trying to show the examiner the best interest for the examiner, not for the patient. Okay, this is the best interest of passing the paces. Then the examiner need to hear these words from you and me and Dr. Rayan and Dr. Mahmoud, Dr. Sarah, from everyone. This is according to the whole tutors, as Dr. Dina said, tutors' experience and practice with other candidate. Along with the feedbacks, no one commented that he mentioned best interests because it's good. It's a good way to convince the patient by any way. Okay. Okay. Thank you, Dr. Ahmed. But always the argument is not the thing. I mean, to make others upset. No, it's to create and to clarify the things. Okay, to create the benefit from the discussion, not to be upset from the way we don't accept or not. Okay, everyone has also his right to accept
Yeah,
this
yeah,
or
yeah.
this.
I'm not just I felt no yeah, yeah, this is my opinion.
Yeah.
It can be wrong.
Yeah.
But this is what I feel. What I feel if I'm speaking to the patient, I will avoid the best interest. I will say by other way. I will say no. We may try another option. It may work better for you. Would you like to try it? It may relieve your symptoms better. Uh,
Okay.
you
So
may use another ways to convince him.
okay. So
Uh,
do
yeah,
it. Do it, and hopefully all of us will pass by your way or by
inshallah,
the best
inshallah.
interest. Anyone has comment about it related to this or this,
مم.
we will
هو
take.
اه
Yes.
هو انا سمعت الكيس دي بيفور، يعني من معرفش دكتورة جاية تقريبا. هي كانت بتقول لها انه الاداليموماب يعني was proven already. So يعني it has proven يعني to improve conditions like your condition. So يعني hopefully it will improve your condition. وهي يعني approved before to be more functioning than the drug you are taking right now. So يعني لكن الدراج ده not proven، ده under trial. تاني حاجة
Yes.
كانت واحد من الكونسيرنز كانت بتقول لها مين اللي هيدفع who will pay for the new drug. فهتقول لها انه النايس مادام هي شايفة انه الدراج ده functioning already موجود في الجايد لاينز، ف the system يعني will pay for you. تمام. مش
Yes.
لكن التاني ده اللي بتموله طبعا الشركة اللي بت ايه
الكومباني. Yeah.
اللي بتعمل ريسيرش. كان في حاجة تانية والله انا يعني مش فاكرة السيناريو، كان نفسي افتكره كله معاكم يعني. بس ما كانش من ضمنها انه بياخد فلوس دي، يعني اول مرة اعرف انه بياخد فلوس من الكومباني.
No, no. Any patient taking medication for trial, he will be sponsored all over the trial,
كان
unless he is withdraw.
اه وتقريبا في الكونترا ده اللي بيبقى بينهم انه you can withdraw anytime you
Yes,
see
he
the
has the right. Yes.
ايوه بالظبط. you has the right to withdraw anytime you see the
Yes.
medication is not working, is
Yes.
not good, is not improving your health. We
Yes.
don't want to make your health under
Trial.
يعني danger يعني.
Oh, yes.
يعني وبعدين انا حاسه دكتور احمد خالط ما بين ايه my wish يعني patient's wish والpatient best interest. انا يعني هو في patient's wish ان هو don't go for dialysis مثلا ويسيب نفسه، هو مش عايز يدخل dialysis. don't go for any intensive intervention. ده
Mm-hmm.
wish، دي رغباته، هو حر سواء كان ده in his best interest yes or no. لكن لما باجي اتكلم from the medical point of view this is in your best interest دي قصة تانية. لكن
ايوه،
هي
ايوه. بس هو
يعني
في الاخر his best interest.
بس هي
هو
دي
اللي
التعبير
يحددها.
بتاع ده. لا التعبير ده تعبير البيست انترست ده بتاع
Dr. Ahmed.
المصلحة from the medical point of view او من وجهة نظر الميديكال تيم. الوش
ايوه،
بقى
ما
بتاعه.
بتبقاش بيست انترست بتاع العيان يا
Dr.
جماعه.
Dina, don't
خلاص
try.
خلاص خلاص لا
Don't
انا
try,
اسفة اني
Dr.
فتحت
Dina.
قصة تاني.
He's hard-headed.
خلاص.
Okay, Dr. Ahmed. As you wish, Dr. Ahmed. In the best interest of Dr. Ahmed Mahanna. Okay? Agree now?
اوكي، agree.
Okay.
Okay, up to you.
Any other comment? No, no, I am joking, Dr. Ahmed. Don't be upset again. Any
No,
comment?
I'm not upset.
Okay.
Just because best
Mhm.
again. And yeah, no need. Just everyone
Yeah,
do
we
it.
got it. By the way, we got it. But we are again using it for the exam purpose.
Yeah.
So,
Okay, I got it.
okay.
Thank you.
Yes,
Thank you.
thank you, Dr. Ahmed. Thank you, Dr. Mahmoud, Dr. Sarah, Dr. Ryan. Anyone want to comment? Please feel free to comment. Dr. Roda, thank you for your comment, Dr. Roda. Please share it to the group. It's a good approach as well. Thank you for your effort. If you can copy it and message it to the group, it will help others. Don't miss smoking alcohol, Dr. Mahmoud, for any scenario in the communication.
Yes.
Alcohol, smoking, job, driving. This is the only history you are allowed to take. So it's easy to ask and you have time to get it. Instead of summarizing or other unnecessary things, you can ask about these things and it might harm him. Right? The alcohol itself can exaggerate, the smoking as well. Driving, it's safe to tell him about stop driving. The job itself might be the trigger for any scenario. I'm not specifying a scenario. For any scenario, these things might be related to the disease or to the condition. Okay.
Okay, Dr. Bass.
Okay. Thank you. Thank you all. Who's someone
Thank you.
asking? Not ask next of kin confidentiality. You can ask and don't talk about the private things, but you have to confirm she is the next of kin. But whenever she asks, since the patient older than 16 years, now he has his confidentiality, don't breach it. Whatever the situation. After his permission only, you can speak about this thing with the mother. Although you have permission from him to talk about, but she doesn't know about the real or the reality. So don't tell her. If he tell, it's his wish. If not, it's not. About smoking and alcohol, you just ask. No one will hide to take alcohol or to smoke. Some of kids or some of the sons, they are smoking in front of parents. So you can ask. If she said, I don't know, okay. If she said, yes, he is, you can give her advice. Okay, I hope it's clear now.
Yes, Dr.
Ask.
Bassem, how old is the patient?
18.
18.
Mhm.
Okay.
Yeah, you want me to ask about the patient? You ask the patient himself, okay? If he is there, I will ask. But in this scenario, why not? I can ask and I can give advice. If he's drinking in front of his mother, she should ask him to stop. This is also one of the welfare. If he will drink in front of her, he might have the seizure, and she should give him advice, and I should give her this advice as well. This is the point. So from both sides, from me to the examiner, to the patient or to the son, and to the mother as well, she can give him the advice whenever she's staying with him at home. But of course, more prior to ask the patient himself if you have sitting with the patient. But if not, you can ask. Okay. Any other comment, questions, inquiry? So we can end the session. We'll meet tomorrow, inshallah, with the clinical day. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh. Thank you all.